Thank you, Mr. Williams, and a pleasant good afternoon to all. I know you mentioned that I would bring you an update on the new regulations, but I just want to advise that the old regulation is still in effect and it will expire on Thursday the 4th, 5 a.m. on Thursday the 4th. However, new regulations have been published, but they will not be in effect until tomorrow. Suffice it to say, there has been no significant changes in these new regulations, and so we continue to be guided by all the protocols that we have become accustomed to. To get into my presentation, I would begin. We are encouraged by the low number of daily new COVID-19 infections. And again, we want to thank you for your actions that have led or that have brought us to this downward trend, that has brought about this downward trend in new cases. All of our gains can be easily destroyed, however, if we become complacent and ignore the protocols and other measures that have kept us safe this far. The COVID-19 Prevention and Control Act and all its provisions are still in effect. We know that the virus is spread through close person-to-person contact, hence the need for adherence to physical and social distancing protocols. Consequently, we continue to focus our attention on bars and other social activities. Regulation 10.5 of the Emergency Powers Regulation outlines the protocols for bars, and these are: 1. All persons shall adhere to the social and physical distancing protocols. That is, persons must have a distance of 6 feet between them. All persons shall adhere to the hygiene protocols. This requires regular sanitization of high-touch surfaces and your hands. The spacing between tables shall allow for a minimum of 6 feet between persons. And all persons, including staff, shall wear a face mask covering their nose and mouth, except when eating or drinking. These protocols will also apply to any social activity outside the bar setting. As always, I want to remind us that we should always wear face masks when in public, avoid crowded places, practice good hygiene and sanitization behavior, and if possible, get vaccinated. Thank you.
Thank you very much, Superintendent Henry. I now invite our Chief Medical Officer, Dr.